Hi, my name is Denise Olsen, and I'm a CTE teacher in Modesto, California. I use Body Interact, and so I'm just going to share how I use it in my classroom. Um, I've prepared a little presentation here, and so I hope I can answer some questions for you. My introduction to Body Interact. I was at a HOSA State Leadership Conference when I saw the Body Interact competition there. And unfortunately, I didn't really interact with it very much there, but I was intrigued. And so I contacted Body Interact and we had a meeting after that where they explained the program to me. And I felt like it would be really beneficial to use in my classroom. We have a program in my district where we have 3 different schools that teach some form of a health academy curriculum. And so I know at least myself and another teacher are using Body Interact this year in our classrooms. And we have a very similar program. We teach sophomores, juniors, and seniors. So I'm just going to skip down to the 3rd bullet point. It's part of our high school health science pathway program. So I teach sophomores medical science 1, and they get health science introduction where they learn about insurance, ethics, history of medicine, those kinds of things in the beginning of the year. And then they start an introduction to the body systems. At the end of the year, they take the health science introduction CTE certification exam, and several of my students just passed that yesterday. So that was exciting. So Body Interact works with the sophomore class because they're learning about body systems. Our junior class, they take medical science 2, and that is a more in-depth program where they're learning more about medical terminology and body systems. So they also take a certification exam when they finish. They take the medical anatomy and physiology certification. So you can see where Body Interact works well with that program too, because I can select case studies based on what body system we're using. And then our senior level classes, they have a choice of 2 different capstone classes. So they can take a certified nursing assistant class where they would actually sit for the state licensure exam after they graduate, or they can take a hospital occupations class where they volunteer in hospitals and other clinic settings like physical therapy, radiology, as the hospitals have room and allow them. So they can get a variety of experiences. So the things that they learn in their medical science 1 and medical science 2 classes actually prepare them for their capstone classes. And being able to see the different scenarios in Body Interact, I feel like helps them to kind of understand what's going on in a hospital or a clinic setting more because they're familiar with the terminology, the lines and the tubes, the specialists, all those kind of things that they get exposed to. And the reason why I was intrigued with Body Interact was because I was looking for an interactive approach for case studies. I had been finding things online, looking at Teachers Pay Teachers to find ways where I could bring in case studies to the book knowledge that we were learning, but it just wasn't very interesting for the students, and there was no cause and effect. So once we learned about Body Interact, I thought, oh, that would be a great way for them to actually see what happens in a real life scenario and maybe even see where they've lost the patient because they didn't do anything or they did the wrong thing. So that's why I really liked it once I learned about Body Interact. So I have students work together or individually. I leave it up to them. So it's their choice whether they want to try to tackle the case alone or if they feel like it's better for them to have a partner. What I found was at first, some of the students seemed paralyzed and they just didn't know what to do when I tried to have them do it alone. So regardless of whether they're working in a group, each student has to log in on their own device, and then they can decide to make the same choices or different choices as they talk the scenario through. And what I think is kind of interesting is you really see student personalities as they're working through the cases. They might initially say, oh no, I want to work with a partner, but then they feel opinionated about what needs to happen. And so then they kind of break off in the middle. And then there's even a little bit of frustration when somebody can actually solve the case and somebody else doesn't because of different choices that they've made. So I think it's great that they can work together, but I also want them to feel like they have the right to make their own choices when they're solving the case. And I think it happens more often that the students start out working together and then they kind of branch off in different directions depending on the results of the assessments that they're performing and also the students' understanding of what's going on in the scenario. Sometimes the kids that understand it maybe want to do their own thing and show the other people that they were right. So it's really fun for me to see the students working together and then kind of not working together, but I like to leave it up to them. I feel like when I have told them that they have to work individually and they can't collaborate, it hasn't really gone as well. So I like to leave it up to them as far as if they want to stay working together, if they want to branch off. But I always give them the option because I feel like it's better to have resources than to be stuck on your own. So what I found, I put study guide on the screen because I found that my students, being sophomores in their first year of a medical science pathway, didn't necessarily have the tools that they needed to interact with the program when we began, and even our juniors didn't. So I created a study guide based on the things that they see when they're interacting with the program. So starting with the basics like vital signs, the monitoring screen on the program has vital signs. And if the students aren't aware of what a normal blood pressure or blood glucose is, then they might not realize that something is wrong in that area. So while I felt like my juniors should have already known it because they were taught it last year, they even struggled with it. So what I did, like I said, I created a study guide and I had the students fill that out before we got very much farther into the program. This is my first year using the program. So initially, I kind of demonstrated the program for them and set them loose, but then I realized they needed more scaffolding. So I felt like it became frustrating for them the first one or two sessions before I created the study guide and had them look things up and use it as a reference. And then once they had that, I felt like they were a lot more empowered to make better choices. So I just started, and on the screen there, you can see there's little different areas at the bottom. So I just tried to include the information that they would need for physical exam, monitoring, tests, call, interventions, and medication. And I previewed a variety of patients that I felt like we would be seeing, and I tried to just compile what I thought the students might need to know from those different things. And there's an example on the next slide about some of the things that I included. So like I mentioned earlier, vital signs. I just had them look up what normals were if they didn't know already, and they could talk with classmates to make sure that they were in agreement. Because if you think that a normal blood pressure is, I don't know, like 180/50, then you're not going to be able to solve your case very effectively. So we made sure that we were all in agreement on what the normal vital signs were. And then I just went through the different areas, like for monitoring. I made a list of things that could be monitored, had them look at maybe why that would be an option, why they would want to choose that one or not choose it. For tests, basically the same idea, looked up different scenarios, tried to come up with a list of tests that was pretty all-encompassing without being too in-depth for them to be able to get through that. For call, so there's different specialists that they can call during the scenarios. And so I had them look up what the different specialists were and, what body system that person deals with. And then they would know, okay, if I'm in a case study about something that's, dealing with the digestive system, then I might call a gastroenterologist, for example. So having that information before they moved forward with doing more scenarios, I felt was helpful for them. Interventions, I had the students look up different reasons why you would use interventions. So on the screen here for immobilization. So initially my students didn't know what a cervical collar was. So I felt like by filling out the study guide to help prepare them, they also learned a lot of things that I might not have already covered in class. And then they can use that information while they're doing their scenarios. And then for medications, a lot of my students did not understand what these classes of medications were because we hadn't covered it in class yet. So I felt like with Body Interact, it's a great way to not only solve a case study, but you're teaching something that I wouldn't have normally covered in my curriculum. Um, I wouldn't have taught about antiemetics or antipyretics. So when I have a student who's studying a case study and they realize the person has a fever, then I can tell them, okay, what kind of medication would you use for somebody that has a fever? So I felt like it was great, not only to help them solve the case studies, but also as another source of information for them to learn that, like I said, I probably would not have covered those different medication classes in the course of learning that we would normally go over with all the different body systems. So I really like that they get the opportunity to see, like, okay, if I try this, does it work? And if not, then we can talk about why. Um, so anyway, I just felt like for my students, giving them a study guide, and then I would, if they were confused or they didn't know, or they were asking me, what is this or what is that? What's a bronchodilator? Then I would have them go back to their study guide and then talk with their group members first to see if they could figure it out. So collaborative learning. So how do I choose my case studies? We have well, I'll just explain when I fit Body Interact in during the week. We have minimum days on a lot of Wednesdays, and I find that that's a great day for us to do Body Interact days. And the kids kind of just came to realize, like, oh, it's Wednesday, we're going to do Body Interact, because we have roughly 40 minutes. And if you don't change the time setting, the scenarios are 20 minutes. So it works out really well. It takes a few minutes for the students to get logged in. Then once they get logged in, they can go through a scenario. If they're able to solve it within the first 20 minutes, that's great. And then I'll talk about what we do after. And if not, they have a little bit of time where they could try it again, and maybe they realize where they made their mistakes, and then they can attempt the scenario again. So I choose the case studies based on the body systems that we're studying. Um, so this screen, I believe I've already chosen more filters. So when you go to pick a scenario, you can choose it based on all these filters that are shown. And the place that I start is difficulty level. So my sophomores, I start them at the basic level at the beginning of the year. I start the juniors at the intermediate level. And then at the end of the year, we jumped up. So the juniors were doing advanced and the sophomores were doing intermediate case studies, because they can learn the pattern and recognize things where I felt like they were ready for more challenge by the end of the year. So it was kind of fun to see them be able to solve the cases more quickly at the end of the year once they recognize things and they use the things that they've learned throughout the year, both in the Body Interact cases that we were doing and in the study that we were doing as we learned more about different body systems. So I would usually I would select the difficulty level first so that I've filtered those out. So I know, like for my sophomores, I'm looking at basic level cases. And then I would use the specialty search so I could target different body systems. I didn't usually use the main health conditions because I just wanted to kind of see, okay, I just want to do a digestive, or I want to do something respiratory. So I could kind of filter it that way. Then there is also a simulation environment that you can select. And since my students are really inexperienced, they're in high school, if there was an option to do a pre-hospital or an emergency room choice for the environment, I choose those because I felt like those were less based on direct administration of medications, those kinds of things. So if you did a scenario that was like a pre-hospital, you would have to kind of do the triage part, and then what you could do, it's more of like a lay or a beginner person treating, rather than having to know specific medication routes of administration and stuff like that. So those were the things that I thought about when I was choosing the different scenarios that I would have my students do. And then after they would solve the case, I like to have an assignment for them to do. And I went through a couple different options of doing this. First, I would assign them to write a paragraph, and I try to include writing in my classroom because that's one of the things as teachers we're supposed to do: reading, writing, listening, and speaking, right? So I found a way that I could use Body Interact and then incorporate some writing without it being a huge assignment for them. So the students would know that they have to have a screenshot, and I have that later on in the slideshow, what I want them to screenshot of their results. And usually my requirement for their score is higher than 50, but this was because this was the first intermediate level case for my sophomores. So I just said, hey, if you guys can get 50% accuracy for this one, I'll accept it. Usually it's higher, usually it's at 70%. And I wanted to know what the diagnosis is. There's a question at the end of all the case studies where you need to choose what the diagnosis is. And so I wanted them to say that so that I knew if they got that right or wrong, but I can usually tell when I look at their screenshot as well. And then how did they come to that conclusion? What were the signs and symptoms that led them to that? That led you to believe the patient had the diagnosis that you gave them. And this student's answer was very detailed. This is a student who really understands what's going on, and they use some good medical terminology and stuff like that. So not all of my students give such detailed answers. I give them examples and non-examples, but this one I felt like I should share one that really gave a good, thorough answer. And so then I do it as a discussion post in Schoology, which is the system that we use, our learning management system. And I don't let them see anybody else's posts until after they make a post, so that they don't just copy what somebody else said. But after they've made their post, then they can look and see if other people had a similar diagnosis and if they gave the same reasoning for it. And although they can work in a group, everyone has to do their own discussion posts so that I can see their own thinking. And of course, people that work in a group, often their answers are very similar, but I want everybody to go through the process of the writing and the thinking and trying to explain themselves, regardless of whether they solve it together or not. So these are the screenshots that I'll ask my students to give me. And I just love the feedback that you get from Body Interact, because you get your global score, and that is everything combined. And then it also breaks it down by physical exam. So what did you do right? What did you do wrong? Diagnostic activity and treatment. And the students have figured out that their global score is going to be low if they don't get the summative question right. So if they get their the diagnosis wrong, even if they've done everything correct, their global score will be a lot lower, and it doesn't add up to what you would expect it to be. So I can usually tell if they've gotten the diagnosis wrong, whether or not they say the right thing in their discussion post based on what their global score is. But I feel like the feedback is a really great tool. If they click on the box where it says timeline there, they can see what they've done, when, and like I said, physical exam, diagnostic, and treatment. A lot of times students will, they'll hear what other people are doing, and so they'll try to jump ahead and try those things without going through the steps on their own patient. And so sometimes they'll say, well, I don't understand. I heard that you had to do this or that in the treatment, but they didn't go through the whole scenario themselves. So it's important that they go through all of the steps. And when you're in a classroom setting, they start talking to each other, and I have to remind them, no, just because you heard that, this is what you have to do at the end, you still have to treat that patient yourself. So I find that students have to redo the scenario a couple times, sometimes depending on the level of difficulty. And they get frustrated because they feel like, oh, I'm so close, but I ran out of time. Or, oh, I made this mistake and then my patient died. At the beginning of the year, we had a lot of patients dying, and It improved as the year went on, so that was good to see. But I really like the feedback that they get, and they can also ask for a hint. So if they're struggling and they don't understand, like, well, I thought that this was the treatment, then they can click on treatment and it'll offer them a hint. And sometimes that's just what they need. And, you know, it will give them a suggestion. So if they retry the scenario, they can try a different direction. So I really feel like this feedback section is super beneficial, and my students feel that way also. It also, I didn't get a screenshot of it, and I might be having the terminology wrong when I'm talking about it, but it's things that they're exposed to. So like it might say 5 out of 6. So if they're like, wait, what didn't I do? Then they can look, and there are different things that they should be exposed to when they do that case study. So some reasons why I use Body Interact. Well, I think I've kind of mentioned this previously, is the cooperative work aspect. I really like that students can work together, and sometimes somebody just does not understand for whatever reason, or something isn't coming to their mind. But when I give them the option of working in groups and in the classroom, they hear each other talking, and somebody might say across the room, like, oh, ask him this question, or check his blood pressure, or do something else. And then it triggers them, oh yeah, that's what I need to do. So I love that it's cooperative work, because it's real world, right? Like, you're never going to work by yourself treating a patient. So might as well give them scenarios where they can work with other people. Real world application of textbook learning. So yeah, we might learn all of the organs in a particular body system, and we might learn on paper what a disease or disorder for that body system is. But what does it really look like if you have a patient present with that? And what does it look like if you do something wrong? So that goes down to consequences of decision making and problem solving. I love it that, you know, if they make the wrong choice, the patient actually shows visible changes, or the answers will change if you go back and ask them questions. So I really like that you can see what happens when you do this or that. And so then that leads to reflection, right? So if the person needed oxygen and you didn't give it to them, you're going to see it on the vital signs. You're going to see their lips turn blue. You're going to see various things. And that will hopefully make you reflect and say, oh, wait, they were fine until I did this, or they were fine until I didn't do that. And so reflection and helping them to see that there are consequences of making one choice versus another choice. And then if they have to redo the scenario, then they can make a different choice next time and see what happens. So that's what I also like too, is that you can redo the scenarios and then hypothesizing about things we haven't studied yet. So we may not have studied medications, like I've mentioned that before, but they can think, okay, if this person has a fever, what kind of medication might help with that? And then they can try that. Or if they're retaining water, what kind of medication would I use? So like I mentioned, they might not know the medication administration route, or if they need to do an IV or not, but hopefully they can figure out the type of medication and then go from there. So it kind of challenges them. So you can set it up for easy case studies if students are just learning, and then the more advanced they get, you can challenge them. So I really like that there's different areas or different ways that you can scaffold it, and you can make it more difficult as the students progress. And there's so many scenarios in there that you can do the same body system using a different scenario, and then they'll get more experiences on that. So recommendations I have for success. I don't know, but I think this is probably something that is common in more places than just my school. Sometimes the internet can be slow. So we do have to be patient sometimes and maybe modify. Sometimes one person can log in, another person can't. So that day I'll say just work on one person's device, but they can still have the same interaction. They just don't get the freedom of doing it on their own if they don't want to. Like I mentioned, take a tour of the program with the students. So at the beginning of every year, regardless if students have used it the year before, I'm going to solve a case study in front of the class with everybody, where we go through all the different icons on the screen. So, we can change the view. We can go through what like for example, go through what the monitor has here, show what each of these areas are and go through. And then I will probably correlate that with the study guide. So I'll say, hey, we're looking at intervention. So if you look at your study guide, you'll notice there's all these different things. So if you're not sure where to look for something, that would be a clue for that. So I think it's a great idea to take a tour of the program before you send the students loose on their own. And then also front loading information. So depending on the level of the student, like I said, I have high schoolers and 10th graders in particular need the most support. The juniors are going to need less support, but making sure they have the information that they need so that the program itself doesn't become frustrating because they're not familiar with the material. It's not their fault that they don't know the medications. So I'm going to do what I can to help them learn that, so that's not a hindrance to them being able to solve the case studies and enjoy the process. And then, be able to ask guiding questions during the scenarios. So I will print out the solution guide before we get started. So if a student is asking me, because everybody's going to be at a different place when they're solving the scenarios. So if somebody asks me, like, I've done this and this and this, I can look and see, okay, what is the preferred solution? And I can try to guide them through questions that will get them to that point. So trying to ask them, well, let's look at the vital signs. What tests have you run? Okay, you've done that. What specialist do you think maybe you should call? So trying to just guide them through the scenarios if they get stuck, and also have students work together too, right? Have you asked your partner, what do they think? Ask them what their thought process is as they're going through the case. And then also I have to do this like every time we do case studies, use the information that you've been given. So a lot of times students just want the answer. So I'll have to go back to the guiding questions and redirect them. Okay, you've done this test. What were the values? Or you're looking at the monitoring screen. I see something that does not look right to me, but you have to try to identify what that is before I give you the answer. And then if they are not able to solve it, or if they are able to solve it, I encourage them to use the feedback provided by the program. So that feedback screen that we went over, I think it's really helpful. And I encourage them to go through each of the sections to look at what they did, because sometimes you can ask unnecessary questions and it will bring your score down in the dialogue section, and help them to figure out why that question was unnecessary and another one was necessary, or what testing. Like sometimes students thought they had figured everything out. Like, I'm just going to ask all the questions. I'm going to do all the interventions. I'm going to do all the monitoring, but it's not necessary. And you might hurt your patient because you're doing unnecessary things. So I encourage them to look at the feedback and see, like, okay, I did this right, but I didn't need to do that. And then that's why my score was lower than it could have been. And then I like to follow up with my students after the scenarios. We like to, students who solve them quickly are usually eager to share what they did, especially if it was a really challenging one and some people couldn't solve it during the class period. So I try to follow up with students and see where they were at, what they had trouble with, what they felt successful with. And then that can also help guide my teaching. Like, next time we go over this, or maybe I need to reteach something because I thought that maybe it would be easy for them to understand, but they struggled with it. So it's good to follow up with students after they do the scenarios, because it can help you direct your teaching. And also you might say, hey, I think we should do another scenario on this body system, because they didn't really understand it as well as I thought they would have. I thought this one would have been an easy case, but it was more challenging. So following up with students and looking at their feedback can also help to guide your teaching and your instruction. So that is the end of my presentation. Those are the things that I felt like I wanted to share with you today. Thank you for listening, and I hope that it was in some way helpful to see how I use the program in my classroom. I really enjoy it, and I plan on using it again next year because I just feel like it's fun for the kids. It's a break from me lecturing them, and they get a chance to work with one another. And some of them, you can just see how proud they are at the end when they solved a case because they can explain what they knew and why they did it. So I think it's just a great tool to incorporate into any health science classroom.